We have a relatively structured schedule when people come in. Typically during the first week, we try not to have contact with outside sources. The clinicians will contact family members and spouses and partners and let them know that they're okay. But we try to have them have a reorientation period where they come in, they settle into the program, they become used to the routines that are involved in this, such as they get up in the morning and they have some exercise time. So we have them go out and do some exercise, then they come back, have a little personal time, clean up, they eat breakfast, and then they go into what we call the Principles of Recovery program. Principles of Recovery is about reinforcing the good behaviors that are going to replace a lot of the behaviors that they don't want in their lives. So we do mindfulness and meditation during Principles of Recovery. We have them go through what we call the treatment pillars, and these are something that Dr. Adias and I developed together that are positive affirmations. We have them read 3 times a day. For here, it's a little different than our outpatient program, but we have them do it 3 times a day for 2 days, and then they move on to the next pillar. And so there's 12 pillars that they go through during their stay here. And these pillars become pretty ingrained into their thinking. In our outpatient program, we actually have them do that for a month. So they end up 99 times. And we encourage our clients as they leave Paradise Creek to continue to do that, to go back and restart their pillar reading 3 times a day and go for 31 days and then move on to the next one. These pillars teach principles, such as the fact that your brain can heal. The principle of balance and equilibrium, the principle of duration, intensity. And as they read these pillars, they become a little more ingrained into the system, into their brain, and they begin to develop healthy habits based around the things that they're reading. We also use Dr. Carnes's 40-day focus program during the Principles of Recovery. So we have them read a 40-day focus chapter that he has written, and we have them write about their beliefs about that, what comes up for them. And they write that, and then they read it to their group. A lot of times in treatment programs, you'll go in, you are assigned a therapist, and that therapist sees you through the entire program. With our technique here, you end up seeing 3 or 4 different therapists during the period of time that you're here. So you get to hear different opinions, different belief systems, different approaches to treatment, and each of us has different tools in our arsenal. We have the tool of EMDR, which we use to treat a lot of the trauma associated with the addiction. We have the tool of a cognitive behavioral approach. Dr. Adias and I have developed a program called CNRT, Cognitive Neurorestructuring Therapy. Psychiatry is the only medical profession that does not look at the structure or the organ that they're treating. And so we really wanted to come up with exercises that help us to restructure the brain. Not only how we think, but actually how the brain works. And we know that the brain is developed in a use-dependent fashion, so as we use these new tools over and over again, what ends up happening is that our brain begins to form those new neural pathways. And we start using them instead of the old neural pathways that led us to addictive behaviors.